Good morning all. Today I would like to share my study on cataract screening, validation of portable Slitscope for graded nuclear sclerosis in outreach scans. Cataracts remains the leading cause of avoidable blindness worldwide. The lens opacity classification system 3 performed on a slit lamp biomicroscope is the gold standard for grading cataract. The early detection and accurate grading of nuclear sclerosis are crucial for planning surgical intervention. And this is the lens opacity classification system 3 for grading nuclear cataract, cortical cataract, and posterior subcapsular cataract. The nuclear sclerosis is graded based on the color and opalences. The importance of grading nuclear sclerosis are pre-operative planning to plan the surgical technique and anticipate complication in surgical difficulty. Denser the nucleus, higher the phacoemulsification energy required in IOL power calculation. Dense nucleus affect the biometry due to poor fixation and in visual prognosis, aiding counseling about expected outcome. We know that slit lamp is the right hand of an ophthalmic surgeon and it is a gold standard device. The advantages of slit lamp are it helps in detailed visualization, has high magnification and strict illumination, and has binocular view and versatile. It can be combined with fundus lens, tonometers, etc. The disadvantages are it is bulky, electricity is needed, non-portable, and a trained personnel is required, high cost, and cannot examine in bedridden or immobile patients. In outreach camp, till now, cataract screening was done by diffuse beam of torchlight. The advantages of it are simple and quick, portable, rapid assessment can be done at anywhere. It is an initial triage tool to triage red eye, pupillary reflex, etc. The disadvantages of it are gives only limited detail, no magnification, and no stereopsis. Here the problem is, while torchlight lacks strict illumination and optical sectioning, leading to limited diagnostic accuracy, on the other hand, slit lamp is bulky, non-portable, and requires skilled handling, making it less feasible in emergency or bedside setting and impractical in community outreach care. To address this problem, we have introduced a new device called Slitscope, which combines the advantages of both modalities and minimizes the drawback, which is a portable, user-friendly, compact, and cost-effective device which replicates the slit lamp-based cataract grading. This is the first model we made here. A black chart paper with the required size slit is stuck to the moonlight torch. Then a 4 into 1.5 cm black chart paper with a hole and IOL is glued to it. Then this chart paper with IOL is glued to the PVC pipe. Then the PVC pipe is fixed to the moonlight torch. This is a simple method and everyone can try this method. This is the 3D printed model of Slitscope. The image showing design of the 3D printed Slitscope, then slit end of the Slitscope. Third is the IOL end of the Slitscope. Then the final 3D printed Slitscope adapter on the torch. Slitscope fabrication of the 3D printed model. For 3D printing, the sketch of the cylinder is incorporated into computer-aided design software with appropriate dimension, and the software exports this model native file format into standard triangle language file, which was used for 3D printing. Then this file was then converted into machine language, that is G code. Then this G code is then sent to 3D printer by Wi-Fi, which gets it to create the Slitscope. It is printed using polylactic acid. This is the final Slitscope. One end showing a 20 diopter IOL which converges the divergent light. The other showing the slit which reduces the aperture of torchlight. It is attached to moonlight torch to create the slit beam. This is the final Slitscope. Then it is set and ready to use. This is how the examination by torchlight. We can see a diffuse light. This is how the examination by Slitscope look like. This is nuclear sclerosis grading in a patient showing grade 2 cataract examined by Slitscope. This is another patient showing nuclear sclerosis grade 3, and this is various examination finding by Slitscope. To evaluate the diagnostic accuracy of this instrument, we conducted a study. The aim of our study was to assess the diagnostic accuracy of Slitscope, examine nuclear sclerosis and compare with slit lamp LOCS grade 3, and to evaluate the reliability and ease of use. We conducted a prospective cross-sectional diagnostic validation study in patients attending a tertiary care center in North Kerala. The 100 participants, 200 eyes aged more than or equal to 50 years. The data is collected by systematic random sampling in 6 months from March 2025 to August 2025. The inclusion criteria: age more than or equal to 50 years, visual complaint suggestive of cataract, ability to fixate and cooperate during examination. And these are my exclusion criteria. Each underwent visual acuity testing, both unaided and best-corrected visual acuity is tested. After mydriasis, then Slitscope grading was done by an ophthalmologist and noted. Then standard slit lamp LOCS grading was done by another consultant, and it is noted more than 5 years of experience. The findings from both instruments were compared. Coming to result, age distribution 50 to 80 with an average age of 64. Gender distribution, male and female shows equal ratio approximately 1:1. This is a graph showing comparison of Cisco versus Slitscope grading and showing similar grades from both instruments. This is a diagnostic performance chart showing sensitivity and specificity more than 90% and the diagnostic accuracy 93% showing an excellent agreement. These are the advantages of Slitscope. The Slitscope offers key benefits that it is portable, less expensive, time efficient, accurate for nuclear sclerosis grading, and can screen bedridden or immobile patient. Coming to conclusion, Slitscope is a reliable, accurate, and user-friendly device suitable for community screening, and it bridges the gap between urban tertiary healthcare and rural healthcare, and help in constructive counseling and patient care, and also aid in early detection of cataract and timely referral. And I hope if validated, this tool can the revolution is cataract detection in rural India. These are my references. Thank you.
Good presentation. Can you please go back to the methodology? Is it possible? You can tell who did this?
Actually, my mentor invented this and I conducted the study.
No. The slit scope usage was done by who used the slit scope? Ophthalmologist?
Consultant, yeah, with a 5-year
you please?
experience to ensure the accuracy,
Okay.
reliability, and to minimize inter-observer bias.
Okay. The same doctor, they did the slit lamp examination also for the patient?
No, another doctor.
It was done by another doctor,
Yes,
not the same person.
not the same person.
Do you have any video of the examination? Because it's a study and you have invented a new instrument. Do you have any video?
I brought it, the instrument, and
You have the
these are
instrument
the
with you. Oh.
images.
And I have a lot of doubts in this. Actually, it is a very good instrument. It is going to be very useful for the outreach camps and all. This can be used by an optometrist also, not only by an ophthalmologist. It will be useful for the optometrist also, and in the vision centers also it can be used. But again, how is the grading validated? Like, do they compare every case with that LOCS grading?
We use LOCS grade 3 because it is international and
What will be the cost of this equipment once you make it?
it cost only about 350. The adapter cost only 350.
Do you get an optical section of the lens?
Yes, we get the optical section,
So
and any type of cataract can be examined.
So if you can get
And
an
also-
optical section of the lens, can you get an optical section of the cornea also?
Yes, we get.
Have you tried that?
Yes. Also, one of the major advantages of it is it can also examine the anterior chamber depth. So we have a plan to conduct a study to screen for angle closure glaucoma based on the limbal anterior chamber depth.
Do you think this can replace your slit lamp microscope? The way you are telling
Cannot
optical section, you
replace,
can
but
take.
it is a complement.
No, if it's an instrument which can get the optical section of the cornea, the anterior chamber depth, and the optical section of the lens, and comparable with the results of slit lamp, it costing only 350 rupees, you can ask for a patent and
Can
go on a
replace
large scale and make
and,
it.
It is better tool for screening in outreach camps.
Actually, nowadays there is no need for grading at all. Everybody who sees a lens, they remove it. There is no need for lens opacity at all.
It will be helpful in that immobile patients who cannot attend the hospital regular visit. So,
Anyway, it's a novel idea, very good.
thank you, sir.
Good. It will really work in the field. You are creating a very good invention which is like very relevant. Only thing, as it was pointed out, that learning curve will be there. Whether you'll have to hold it obliquely, whether you'll have to hold it coaxially, we aren't sure. We aren't sure. Point number one. Point number two, why you are restricting to only nuclear sclerosis, I'm not sure. Even a posterior subcapsular this should pick up.
Yes.
If what you are saying
Yes.
is true. Even a PCU on the other eye, it should pick up.
It can
Argumentative.
detect all type of cataract.
So in
anterior
a field
chamber
case
from
where
the
one eye
lens.
has cataract, other eye is already operated 2 years, 3 years back, a PCU on the other eye also, it should pick up.
Yes, sir.
And more than that, the magnification factor and the comfort factors which a slit lamp gives, this cannot give. So this will not you are not planning to replace the slit lamp.
Yes.
So go in that angle.
Yes.
Try to complement
Yes,
just a
complement.
torchlight, oblique illumination with the torchlight with a more validated approach where more clear notes are given about the type of the cataract and the grade of the cataract. We are in the base hospital approach only. There is no camp surgeries anymore. No, all these patients go to the base hospital and they are getting evaluated against there, and then they are getting operated. So in that you are only validating that process. You are making it very pakka. You are no vagariness is coming inside. Very good. Try to work on this and also work on the cortical components of either other than just NS1, NS2, NS3, NS4.
Yes.
Okay.
Is it battery operated or chargeable?
The Moonlight torch contain battery. That only the torch contain battery. It is not battery operated. The
Can you
adapter.
show us?
Yes.
Can you show us the slit scope?